we are traumatized ourselves. COVID-19 has challenged how government provides services to our people. As we ask people to wash hands regularly, challenges of access to water have come to the fore. We want to condemn the deliberate destruction of water infrastructure that has been happening in Amatole and Owar Tambo district municipalities in the name of labor disputes. We welcome the breakthrough that Amatole DM has reached with the labor, and we encourage Owar Tambo district municipality to engage workers in good faith, knowing that municipality is mandated to provide basic services to the majority of our people. The revolution is about toiling and downtrodden masses, not the privileged few. You get a salary because you have worked. You get all benefits because you have worked. Think about those masses that have got nothing to lose, that can wake up tomorrow and make you to be unemployed in the midst of all the demands that you are making. What is due to workers must be given to workers. But there must be a responsibility to that. We can't collapse government simply because they are unreasonable demands. But there must be commitment from employers to see to it issues that are raised are actually engaged properly. And workers must also negotiate in good faith. We don't want politics about provision of basic services. They are not involved in politics. Don't get involved. Don't use politics into that space. Municipalities must function solely for what the Constitution has established them for. On addressing healthcare challenges, we definitely want to find sustainable, innovative solutions to improve our care system. We will be engaging the private sector to pump in more investment into our healthcare sector. As government, we are willing and ready to create a conducive environment for potential investors who want to enter the private sector, private healthcare space in our province. We believe that the province has got market with the population it has. So we must really open up that space, relax that space, liberate that space, so that more people would want to come in. Other provinces perform better in big cities, not because of the public healthcare system alone, but also with the capacity they have through the private sector investment in the healthcare. So we've got to look at that. And this is one of those challenges that we've got to work on as we try to find a sustainable solution to the challenges of healthcare system in our province. Another area of concern which we will take up more robustly with our national government colleagues is the provision of services in post offices and Home Affairs, as well as the Department of Employment, the Department of Labor as it is known. Those are areas that always give us headaches in terms of unmanageable queues because of poor systems, this today, tomorrow that. People have been sent from pillar to post. We will be engaging these ministers and this department around this and see what else can be done. It's a terrible scene what we see in rural areas, in towns, where people must always queue in post offices in order to get, and sometimes there are no post offices. Some were closed. I came across a post office here in Middle Drift, going to another rural area, seeing people queuing. When I went there, the team that saves the post office is in Alice, because there's been actually robbery there. Almost a year, the post office is difficult to open. It's a common thing, because these post offices are also a target of thugs and criminals because of money that is meant for our ordinary people, where they should be getting services at their doorsteps. So, but government cannot really be resting on laurels on that. Our people are dying. Those are potential super spreaders, if not super spreaders, as we speak. So that remains a concern that we have. We are not seeing improvement in the provision of services in those areas or service points. And our people are at risk of getting infected while standing in long queues. There is a need for interim alternative ways of providing better services to our people by both or these departments that I've mentioned. On the economy, the move to alert level 1 was meant to kickstart economic reconstruction and recovery in our country. And as a province, we welcome it with great enthusiasm as we wanted to ensure the livelihood of our people are restored. We are happy to announce that no investors were lost in the province due to COVID-19 expansion, and expansions for operation have resumed after the opening of the province, especially those investors that we have secured through the National Investment Conference. But we still have challenges with SMMEs who are also investors themselves, who are going through this, and I've convened a meeting to say to it that we need to have a kind of a tailor-made packages that are meant to help those SMMEs so that they don't have their factories collapsing. As of 14 December 2020, 17.4 million rands working capital inclusive funding of the Jobs Fund was approved for 22 distressed companies in manufacturing, agro-processing, and tourism to protect 1,123 jobs. About 43 applications from businesses are in the pipeline for processing, and these are to protect 1,098 people from losing their jobs. The target going forward is to provide 39.2 million for distressed businesses to save a minimum of 2,700 jobs. As of the 9th of December 2020, 3 billion of the COVID-19 temporal employer or employee relief scheme was paid to 72,188 employers, benefiting more than 730,000 employees in our province. We continue to monitor businesses for compliance with COVID-19 regulation. As at 14 December 2020, 1,605 inspections were conducted with overall compliance level at 72%. Affirmation of local SMME in our procurement spend and goods and services is gaining momentum because they are key to economic growth and job creation. In conclusion, this summer is not a normal holiday season that we are used to. However, we can still make it cheerful by acting responsible for the sake of our families by adhering to health protocols that are in place to protect all of us from COVID-19. Unfortunately, COVID-19 does not go on holiday. Hence, we cannot stop wearing masks, washing hands, social distancing, and staying at home during this holiday season. Nevertheless, I wish all the people of our province a safer holiday season. Spare a moment to think about those who lost their loved ones during this year and pray for the healing of their pain. This is a season of goodwill. Also, kindly share food and clothes with the less fortunate and destitute. Stay healthy. We want to see you all alive in 2021. Let me further express my sincere gratitude and a word of appreciation to all South Africans who showed me and my family amazing love and support during my difficult time of directly experiencing the pain of this virus. An experience that I would not wish for any human being. As you enjoy yourselves, remember the words that were shared by the President in his last family meeting when he said, and I quote, "If we do not do things differently this festive season, we will meet the new year not with joy, but with sorrow, unless we do things differently. This will be the last Christmas for many South Africans." Close quote. Happy summer holidays, peace, loving people of the Eastern Cape. Thank you very much.
Thank you, Premier. We will now take questions from the members of the meeting. Those that are joining through Microsoft Teams, please raise your hand here or write in the chat box if you want to ask a question. But we'll start with journalists that are here. Let me see hands. Okay, there are no hands from the hands.
Good day, Premier, and everyone who's here. My name is Abongile Yankis from SABC News. Premier, throughout the year, there were investigations such as the SIU investigation into COVID-19 corruption, and you further announced that there were lifestyle audits that were being announced, that you announced, and we just want to know how far are those processes. And for you, in a nutshell, how would you say this administrative year was, since we were coming to an end, since this is the last briefing for the year? I thank you.
Okay. Any questions? Rating? Okay. I don't have any questions from myself.
Thank you very much, Abongile Janchis. You must understand that you've never experienced COVID. You must not ask everything at once. You see, I'm still recovering, so you must be happy to see me back. The investigations are ongoing. We had one briefing by the SIU. SIU is indeed in the province, as per the request we made sometime in May, as the provincial administration, when we heard a lot of allegations that were flying around on issues of corruption, etc. We are waiting the SIU to give us the final reports on all the areas that they were looking for, and therefore we cannot comment on something that we don't have. We are waiting in anticipation, and ours is to implement that report. When it's out, we'll just implement it without fear or favor, or without fail. The lifestyle audit is a process that government is actually undertaking. All MECs have signed letters of consent or forms of consent. We have asked a government responsible agency or entity to look after that. So we are patiently waiting for that process. At least MECs are not going to run away, or public representatives are not going to run away. When it is done, it must be done properly, because we want to ensure that all those who occupy public office do understand that these are indeed public offices, not private offices. Whatever that you do, you must understand that you will be answerable to the people of this country. So we're committed in fighting any form of corruption wherever it shows its ugly head, but we're not going just to be jumping around, throwing tantrums, following perceived corruption. That's why a due scientific process must be followed. This is a kind of a due diligence that we've committed ourselves in. So SIU competence is going to help us on a number of areas that were raised and picked up. And all other agencies, including Hawks, in the work that they are doing as well in the province, following up. And we believe that Fusion Center work in collaboration to ensure that all these kind of issues are attended to. Ours as government is to simply make sure that we cooperate. All our municipalities are clear. All our government departments are clear. When there is a case to answer, you must simply open up your heart and your mind, answer that, because it is meant for public purse. And we want to clear all this. It's not good to hear that Eastern Cape is #1 on corruption, simply because people are driving a particular narrative based on their perception. At least now people can wait that there's a process that is being undertaken. If there was a wrongdoing in procurement, that must come forward. At least there are laws and regulations, including COVID-19, was properly regulated through the guidelines which were developed by National Treasury. So it's not a difficult thing. It's not a far-fetched thing that we are looking for. So everyone who might have gone outside what was regulated, there is something wrong with that. We made a commitment earlier this year that we've got to confront the challenge in the province that has been characterizing our administration for years. The irregular expenditure, the fruitless expenditure, to ensure that we improve our audit outcomes. So that one on its own, it is part of the work that we're doing to clean the government system, combat corruption. We're appealing to everyone, workers, leaders, wherever you are, make sure that you don't do something to serve your own personal interests or your friends. Do something that is going to make impact to our people. Our people are crying for roads. Our people are crying for water. Our people are crying for hospitals, clinics. Our people are crying for schools. So if there is any leak in the system, to them, it becomes a worse traumatic experience that you can think about. So our appeal is that let's work together on this, fight corruption wherever it shows its ugly head, but use the institutions. We've been observing this problem of people who go public to create doubts or try to deal with integrity of our law enforcement agencies. I don't think it's something that must be allowed. It's something that must be confronted. If you go public and say something, at least you must be held answerable to that, especially when you are trying to undermine the work of the law enforcement agencies. So at least you must respond. Why are you saying that? If you have got any proof, go to those SIU, go to those hawks that are on the ground, give them this information that you have so that we deal with this issue once and for all. We're not going to bury our heads on the sand in dealing with corruption. We've got to stand up, look at it, face it. Whoever does it must be held accountable and must be given a chance to respond. We've engaged with law enforcement agencies that they must arrest to prosecute. They must not arrest to investigate. This issue of arresting to investigate creates doubt, creates dark cloud. That's what makes people to feel that there's something that is going on that is not right. So if you arrive at a point of arresting, arrest to prosecute so that you don't keep people waiting for months and months without their kind of charge sheets. Deal with that issue with honesty. Stay away from politics if there are any politics involved. Focus on issues at hand. Investigate without fear or favor. Bring forward whatever that you have managed to. We've got to work together to clean the government. The government must actually rise to the occasion. This administration has been given a clear mandate by the governing party to work on this issue of fighting corruption and build a capable, a developmental and ethical state. So that's a mandate that we have. Our government must be capable to deal with this, and state must be able to be capable to deal with this and help us to move forward. Year 2020 was indeed a difficult year. I think you have seen it as well from where you are. It hasn't really been an easy year with all the attempts that we've been making. Surely some critical pronouncements, major, that we thought will help us, if you talk about catalytic projects in the province, will help us to create or change the socio-economic outlook of our province. We're almost falling flat, but since the alert level 1, we are actually recapping, we are reconnecting, and kind of resuscitating all those attempts that we've made in ensuring that our Operation Kauleza, with all work streams, they follow up on almost every aspect that is out there, and commitments that have been made by all our spheres of government. You would understand that we've been talking about the new normal. We've been talking about the business continuity. These are new terminologies that have arrived in our vocabulary in understanding the situation that we're dealing with. Government has been actually providing services. Government has been working. We have never closed government under very difficult condition. We continue working at a very risk-adjusted approach, saving more lives, but at the same time, balancing that equation with the preservation of their livelihood. So this is the kind of work that we're doing, of course, under very difficult condition, I must say, because other people are losing lives whilst we are trying to busy make sure that government delivers services to our people. But it's a year that we had to make sure that we put it under microscopic view from a monitoring and evaluation point of view, but also from the oversight point of view, with all these malfeasance that we got exposed to earlier on when we were starting to grapple with this issue of COVID-19. At least now we know. That's why we have said, whatever money that we do, let's not just spend it. Let's put it, let's create legacy, build capacity of our hospitals for future. We are happy that we have done that very successfully. But also, we're also happy that more than 70% procurement done benefited the local SMMEs for the first time in the Eastern Cape. It is just painful and worrying that when more SMME previously disadvantaged people are benefiting, there's a lot of cry on corruption. And it's also bad that the corruption seems to be synonymous with black people in South Africa. So that's another issue. I know the more abantu abamnyama baba neziduko nethi ube nesiduko sekuhalelwa into besasiduko sakho singqamene nesiya, therefore by association inoba you are corrupt. These are bad things that we are also doing in destroying our SMME. So business sector out there must be able to stand up and to fight these things. And I, as a premier, I'm quite happy that a lot of money which was actually earmarked for COVID-19, be it PPEs, was spent on the local SMME. Those who have done wrong, they will have to answer for that, because we are not giving a blanket approach on that. There were laws in place and people had to follow those laws. If there were procurement processes undermined, those responsible must actually be held answerable to that. Thank you very much.
We have a question from the Daily Dispatch. Hello,
We can't hear you. Fondo. We can't hear you, Mfundo.
Can you hear me now, sir?
Yes, Mfundo, try again. Can you mute him, boss? Yours.
Can you hear me now?
We can't. Why don't you text it? Why don't you write it there in the chat box?
text here. There's a text here, Premier. Why are the special advisors to the Department of Health and Premier saying two different things about the state of hospitals with regards to COVID-19? With regards to COVID-19, Dr. Pillay in the Nelson Mandela says the hospitals are full and there are no ventilators. But Dr. Megasha expressed a different view, saying the hospitals are not full.
Thank you very much, Mfundo. Firstly, Dr. Pillay is not a special advisor. He's part of the panel of experts. And he has got even no right to speak public about that. Not that we are hiding anything. What we give you is what the system provides us. What Dr. Mbengashe would have said would be the same thing that Dr. Zungu or MEC for Health would be saying, because it is based on the empirical evidence we have. Yes, there will be always such kind of congestions as we are indicating, but it is a fact that we do have these beds available. As I'm speaking to you, I even called CEO of Livingston Hospital myself yesterday, following up on these issues. And he assured me that there are still more beds available, with also more new beds that we've created in Nelson Mandela. You remember that we have converted or decanted the TB hospitals and made them available for COVID-19. Those hospitals are there, those beds, those hospitals have been renovated, have been updated. So I wouldn't understand, and I will still have to check with Dr. Pillay. We appreciate their contribution a lot in the panel, because they are forming part of the Provincial Coronavirus Command Council. These reports that we're talking to are presented there. At no stage where he has ever disputed this information which is presented from our hospitals to a level of Provincial Command Council. So it's something that we needed to make a follow-up on, but what we are giving you here, it is really the status quo of what we have in our hospitals. Thank you very much. Abanye ngomvusi sabathumela i-speech.
Thank you, Premier. Thank you, Premier. Thank you very much, members of the media. Thank you for everything, for your support throughout the years. We'll probably talk over the phone and via WhatsApp. So this is probably... Yes. Let me see.
Sorry, but I was just writing on the side here now that we're coming at the end. Premier indicated that it's MEC totally noted. Premier indicated that abantu observe so that imigidi ingachinji ibe funerals. He was emphasizing abantu must observe. So I just want to appeal about should not read Premier to mean that imigidi ivumelekile. He was making a different point, but abantu abasawuhlanjwa imigidi ayivumelekanga.
Yeah.
Thank you, MEC.
Thank you very much, MEC, for that addition. You are right. As we said, we are encouraging our people. We know all gatherings have been given numbers, but we are very much careful on imigidi, and we are pleading and appealing with our people that imigidi mayilandeliswe. Amakhwenkwe makahlanjwe xa iphuma esuthwini ayalwe. Loo nto iyenzeka ayizuqala ukwenzeka ngeli xesha le-COVID-19. Abantu bakuthi abahlupheka baqhelene naloo nto bayayazi iyenziwe. Siyabacela ke abantu bangeli xesha ke senze loo nto sinyamezelane umgidi singawulandelisa ngexesha elifanelekileyo sonwabe kuba yindlela yokonwaba nokwamkela umntana ekhaya. Thank you very much.
Thank you, Premier. Have a safe holiday. Premier. Safe holiday. Safe holiday. Safe holiday, everyone. Thank you. Goodbye.